Can you reverse diabetes? When your blood sugar levels, also known as blood glucose, are too high, you get diabetes, also known as diabetes mellitus. The body's major source of energy is blood glucose. It is absorbed from meals and enters cells with the aid of the pancreatic hormone insulin. More than 34 million people in the United States have diabetes, with 90% to 95% of them having type 2. It primarily affects persons over the age of 45, although children and young adults are becoming more affected. Is it possible to reverse diabetes? Both prediabetes and type 2 diabetes can be reversed. Type 1 and gestational diabetes are not curable. Patients may only treat and control their symptoms. Insulin resistance is a condition in which a person's body does not respond effectively to insulin, allowing glucose to linger in their blood and not reach their cells, resulting in health concerns. Other diabetics either don't produce enough insulin or don't produce any at all. There are several types of diabetes. Type 1 diabetes is when the body doesn't make insulin. The immune system targets and destroys insulin-producing cells in the pancreas. This kind of diabetes is most commonly diagnosed in young people, although it can strike anybody at any age. Patients with type 1 diabetes must take insulin on a daily basis. Type 2 diabetes is caused by the body's inability to produce or utilize insulin properly. Diabetes mellitus is the most frequent kind of diabetes. Type 2 diabetes is most common in middle-aged and older persons, while it can occur at any age. Gestational diabetes develops in pregnant women. It normally goes away after the baby is born, but it increases the mother's chances of developing type 2 diabetes later in life. During pregnancy, diabetes can be type 2 or type 1 diabetes. People with prediabetes are also diagnosed by healthcare practitioners. When blood glucose levels are greater than normal but not high enough to be diagnosed as diabetes, this is called hyperglycemia. Prediabetes is a condition that increases the chance of type 2 diabetes and shares many of the same causes. What is the best way to reverse diabetes? Blood glucose management is the initial step towards diabetic remission for those with prediabetes and type 2 diabetes. This is accomplished by taking medication if necessary, eating nutritious foods, and decreasing weight to help the body respond to insulin more efficiently. In persons with prediabetes, these treatments can help reverse insulin resistance and prevent or postpone type 2 diabetes. The Diabetes Prevention Program, DPP, a long-running study financed by the National Institutes of Health that began in 1996, found that adults at higher risk of diabetes can lower their risk of acquiring the condition by losing 5% to 7% of their beginning weight. That's 10 to 14 pounds for someone weighing 200 pounds. Participants in the research lost weight by altering their diet and increasing their physical activity. 1. Dietary changes. The American Diabetes Association, ADA, teamed up with a group of scientists, doctors, diabetes educators, and dietitians to figure out which healthy eating habits are best for diabetics. They looked at over 600 study publications and discovered that while no single diet is effective for everyone, adopting a few suggestions can help patients manage their illness. People with diabetes should consume more non-starchy veggies, whole grains, unprocessed foods, and less added sugar, according to their findings. For diabetes patients, the diet itself or food doesn't matter, it's more about portion control and longevity, whether you choose low-carb diet, ketogenic diet, Mediterranean diet, or intermittent fasting. There's no difference between one diet or another, says Ghada Elshimi, MD, an endocrinologist with Augusta University Health. The most important thing is to stick with one diet. And we tell patients they have to eat more vegetables, more protein, and fewer carbohydrates. The diabetic plate technique, which is also supported by the American Diabetes Association, is what she suggests. It divides a meal plate into 3 sections, non-starchy vegetables in half, protein in quarters, and carbs in the last quarter. Dr. Elshimi goes on to say that diabetics should limit themselves to 60 grams of carbs every meal, equal to 1 bagel, and the less complicated the meal, the better. 2. Calorie restriction. Isn't it possible to consume a low-calorie diet? In a tiny trial published in 2011, researchers limited type 2 diabetic patients to only 600 calories per day for 8 weeks. The researchers discovered that the underlying indications of diabetes, such as insulin resistance and pancreatic function, began to recover, indicating diabetic remission. More study in a wider group of people, however, is needed, according to the researchers. Other studies have found that gastric bypass or bariatric surgery, which decreases the size of the stomach and restricts calories, can treat diabetes. In one study, researchers in Denmark looked at nearly 1,100 participants who underwent gastric bypass surgery and had type 2 diabetes. After a year, 74% no longer needed blood sugar drugs, but 27% had their diabetes return after 5 years. People with type 2 diabetes or other major weight-related health issues including sleep apnea, high blood pressure, or high cholesterol who have a BMI of 35 or above may benefit from a gastric bypass. To reduce and maintain their weight, those who get the procedure will still need to make major lifestyle adjustments. After surgery, some people experience problems and may not be able to correct their diabetes. 3. Exercise. In order to manage type 2 diabetes and prediabetes, regular exercise and a reduction in body fat are essential. Physical exercise improves insulin sensitivity in the body's cells, allowing it to perform more efficiently. Experts recommend 20 minutes of moderate exercise every day, including cardiovascular activities such as running, cycling, or trekking, as well as resistance training like lifting weights to create new muscle. Before beginning a new fitness regimen, those who aren't extremely active or have health problems should speak with their doctor. 4. Medication. Medication may also aid in the prevention or reversal of type 2 diabetes. According to some study, persons with diabetes who start taking insulin as soon as they are diagnosed have a greater chance of living without it in the future and have fewer diabetic complications. The DPP study discovered that using metformin, a diabetic medication prescribed by doctors, can help patients avoid acquiring the condition. GLP-1 agonists and SGLT2 inhibitors, two types of type 2 diabetes medicines that healthcare practitioners prescribe to enhance blood sugar management, can also cause weight reduction. According to studies, diabetic individuals who use a GLP-1 drug can lose 3 to 5 pounds on average. With lifestyle modifications and diabetic medication, that amount rises to 6 to 9 pounds. There's also appetite suppressant medicine. The most successful treatment for this purpose, according to Dr. Alshimi, is Xymia, which she exclusively advises for type 2 diabetes patients with a BMI of 27 or above. Those who take this medication should only use it to supplement other lifestyle modifications. They will need to take it for the rest of their lives to maintain their weight reduction. Other lifestyle and medical considerations to consider when working toward diabetes reversal include medication, nutrition, and exercise. 5. Sleep. Sleep, metabolism, and obesity have all been linked in studies. We get more hungry when we don't get enough sleep, especially for high-calorie and high-carbohydrate meals. Scientists think that sleep has an impact on the hunger hormones ghrelin and leptin in the body. Another aspect is that not getting enough sleep depletes our energy for physical activities. Most people should obtain 7 to 9 hours of sleep every night and practice good sleep habits such as removing electronic devices from the bedroom and avoiding large meals 2 to 3 hours before bedtime. 6. Mental health. Anxiety, depression, and a loss of interest in formerly pleasant activities can all be symptoms of sickness. Diabetes patients are 2 to 3 times more likely to suffer from depression than those who do not have the disease, yet only 25% to 50% are identified and treated. They're also 20% more prone to suffer from anxiousness. Those attempting to reverse diabetes may experience similar sensations if they do not see the expected outcomes or do not have the support of friends and family. 7. Smoking. Smoking can induce type 2 diabetes, and smokers are 30% to 40% more likely than non-smokers to get it. They also have a harder time managing the condition and are more likely to develop other major health issues like heart disease, poor circulation in the legs and feet, nerve damage, and eye disease. 8. Treating polycystic ovary syndrome, PCOS. PCOS is a prevalent cause of infertility that affects up to 5 million women in their reproductive years in the United States. Women with the disease have difficulty utilizing insulin properly, increasing their risk of developing type 2 diabetes. By the age of 40, more than half of women with PCOS had developed type 2 diabetes. People with these health issues should seek treatment from their healthcare professional, which may result in their diabetes being reversed. How long does it take to reverse diabetes? When persons with type 2 diabetes see their hard work pay off, there is no predetermined timeline. Diabetes patients may see an improvement in 3 to 6 months with medication and lifestyle adjustments, according to diabetes specialists. It may take a month to normalize blood sugar, with or without medication, followed by a few months or more for lifestyle modifications to take effect. With enough work and time, you can do it, says Stephanie Redmond, PharmD, BC, ADM. Co-founder of DiabetesDoctor.com. The longer you've had diabetes and the higher your sugars have been for a sustained time, the harder this might be. Redmond adds that despite their best efforts, it may be impossible for some to become diabetes-free. Your pancreas just can't produce the insulin it needs. There's no point in stressing or beating yourself up. Work with your healthcare provider on the best medication plan for you. The average blood sugar levels, hemoglobin A1C, during the previous 2 to 3 months are measured in an A1C test. Normal hemoglobin A1C is less than 5.7%, prediabetes is between 5.7 and 6.4%, and diabetes is 6.5% or more. A1C tests should be done at least twice a year for those with type 2 diabetes, and more frequently if they change medicines or have other health issues. People working to reverse diabetes may see a difference in their blood sugar right away and be tempted to go back to their old ways. Don't confuse this, Redmond says. If you stop eating sugar and carbs and exercising, you may have lower or normal blood sugars almost immediately. But, it may take much longer to reverse the damage that the pancreas has endured and start to cut through the body's insulin resistance and inflammatory state. Diabetes that has been reversed may reappear. Diabetes patients already carry a gene that renders them insulin resistant and vulnerable to the condition. Diabetes reversal necessitates a sustained effort over several months, as well as the ability to maintain adjustments for the rest of one's life. Disclaimer. This video is solely meant to provide general information and does not address specific circumstances. It is not a substitute for professional advice or assistance, and it should not be used to make any judgments. For the diagnosis and treatment of any medical issues, a professional physician should be consulted. Any decisions you make based on the information in this report are your own. If you're looking for weight loss secrets, have a look at this.